going to demonstrate discontinuing in the IV. You have to have a doctor's order in order to do that. So we have to verify that we have a doctor's order to discontinue the IV. The person doesn't need the fluid anymore, doesn't need maybe the IV antibiotics anymore. That'd be a reason to discontinue the IV. They're going home. One thing to make sure you check before you do discontinue an IV totally is to see if they're on any IV antibiotics yet. Then they might just need to put a saline lock in. So when you're checking the order, make sure that they don't have any antibiotics ordered, that they still need to get done first. So we checked that. We checked that there isn't any antibiotics that they'll need. They definitely are going home. They don't need the fluids. So we're going to completely discontinue the IV. Okay, so I'm going to need my supplies. I'm going to make sure that I have a 2x2. I make sure I have a Band-Aid and my gloves. You don't need sterile gloves, just regular clean gloves. So I'll come into the room, introduce myself to the client. Hello, Mr. Anderson. My name is Nancy Yohnhak. How are you today? We're going to get to take out the IV. I'm just going to check your ID band, make sure I have the right client. Also, I need to check to make sure they don't have any allergies, if they'd have any allergies to the adhesive in my Band-Aid or just any kind of an allergy, to make sure that I'm aware of that. No allergies, so we're okay there. I'll need to check the site just to see once if it's infiltrated or anything. We're going to be seeing it anyway, so that's okay, but just to make sure there's not a lot of swelling and just to make sure everything's okay. I'll come over here, make sure the clamp is shut off, or if it's on the pump, make sure that's on the stop. Sometimes that'll keep beeping, so just make sure you've stopped it. Before you completely shut the power off, make sure you check the solution, because you'll want to do for INO to see how much has gone in. So before you'd ever shut the power off, make sure you check to see how much has infused. So, but I'm just going to stop it, and I've got the clamp shut. Then we're going to put some gloves on here in case there would be some blood leaking, and there probably will be a few drops. That's normal. I'll explain to my client I'm just going to discontinue that IV. It'll be so nice. You'll have a little freedom there to be able to move that arm. So we've got the IV in sight here. And my gauze ready. This is just a clean procedure, not sterile, so let's keep that handy. Okay. Loosen some of the tape. Can you see that? Okay. Loosen some of the tape here. Keep that nice and stiff. Make sure there's enough tubing on there so it doesn't pull. And I've already clamped it shut so that it won't be, IV fluid won't be leaking all over. So make sure you have that clamped. Also, when you're pulling the op site, pull it towards the client. It's just a little easier on their skin. You're not pulling on their skin. And make sure, see how I've always got that stable in my hand as I'm pulling this IV side away, the op side off. And some other things too you can do is you can hold their skin as you're pulling this away. Just different things so that it doesn't hurt. It's usually not too bad. Okay. Got it upside. And my 2x2 handy. Place that over. And then just gently, I don't want to press too hard on there where I can't pull this out or break it. But just gently hold on to it, cover the site, and then just gently, smoothly pull that out. Hold pressure and raise the arm. This person's arm. Raise it up so it doesn't bruise and stops the bleeding. Sometimes if they're on like a heparin or a Coumadin, you might have to hold that longer to stop the bleeding. And then you'll want to check your cannula. Make sure it's got a smooth tip, like an arrow-like tip. Make sure it's not jagged or cut off. You just want to make sure it's a nice smooth tip, and because you have to know it, the cannula intact. And that's when it has a smooth tip, then you can chart that it's intact. Okay. bleeding for a minute. I'm just going to set this right here for a minute while I secure this with the Band-Aid. Take a look. Make sure it stopped bleeding. Sometimes you can leave that 2x2 there if you want a little more of a pressure dressing on there. There you go. And then remove this. Note how much solution is left in the IV because you'll need to note that at I and O. Note how much is left and how much is already infused. What's infused goes in your I and O, that they've taken that in, and what's left, you put that on your IV flow sheet that you've wasted that much. So let's say it would be down to the 1 here. They've infused 100 cc's, that would be an I and O, and then 400 is what I'd be wasting. So go ahead and discard this. Like Bonnie said earlier, you have to, with the spikes, you might have to put that into the sharps container, and then the IV bag, you just empty that and then put that bag in the wastebasket. And that is all for our procedure.